Hi everyone, Dr. Nemechek here. I want to talk about the use of glutamine for this COVID damage to the gut, or what we call COVID enteropathy, and what to do if it's causing some kind of agitation or just negative behaviors, especially in children. So here what's going on is in terms of getting neurological recovery, the key is lowering inflammation. All right? And so we use the fish oil, the olive oil. Those are great. You use the right brands, they don't fail. Some people are using VNS in addition for help. It doesn't fail. Those are not a problem. The problem, if you're having poor recovery, is in the intestinal tract. Okay? And there's basically three ways to think about this. And so this is the lining of the intestinal tract. So here, this is one bacteria. This is normal. There's no leaky gut here. When we talk about in our book about the fish bacteria in the colon living up with the bird bacteria in the small intestine, that's SIBO. These are supposed to represent bacteria. Here you get leakage between the cells, okay? And in this space down here is 70% of all the immune system, all the white blood cells. Inflammation comes from your white blood cells when they interact with stuff that's not you. So like you'll have fragments of viruses or bacteria or fungi or food particles coming through here, and the immune system a huge part of the immune system will flare up. That inflammatory stress can get in the central nervous system. No recovery, okay? It's been discovered about 2 years ago where the first papers reporting that COVID is causing a different form of injury. Look, this is the entire cell is dying, okay? Now, very quickly, what's happening here, and I talk about this in more details in other videos, you get intense stress, inflammatory stress from COVID. It's very unique in how much it does. It's much worse than like influenza, okay? This is a very unique thing. It causes a relative deficiency of an amino acid in the body, and amongst the several things that go wrong, the cells lining the intestinal tract die. And now you have this huge gap. You're just flowing stuff into the immune system again. And this over here with SIBO, we just call it increased permeability. Here we call it hyper-permeability, okay? And this is so bad and can sustain this on its own now, this very high inflammatory stress level, that you can't fix this problem on your own. It won't heal. So what we have to do is give the body glutamine. Now, when you give glutamine to people, say somebody's normal, and you give them glutamine, does nothing. You won't notice anything. It won't make you healthier, because the fact that your gut's fine is a sign that you have enough glutamine in the body. You don't need extra. It won't do anything, okay? If you get too much at one time, it might give you a little loose stool. Other than that, you're fine, okay? And so most kids, most adults, they take glutamine. They don't have any negative effects. They've shown in adults the inflammation starts dropping in 5 days. Okay, it starts healing fairly rapidly. This will all heal up. The inflammation comes down. And after 6 weeks, 8 weeks, the inflammation is down enough that you can stop the glutamine. And now you can make enough glutamine internally to keep you healthy. All right? And so essentially your gut then would look like this over here. But we have some kids where, and these are kids particularly with autism, their behavior gets worse. They get more agitated, hyper, anxious, maybe aggressive. Now what's going on here, it's not from the glutamine, okay? These kids have autonomic dysfunction causing slow motility, and that slow motility can cause the colon to be packed up with stool. Whether it looks like constipation, they can go every day, but they've got all the stool in their colon, and you won't necessarily know this as a parent. So kids have that. And then when you have the COVID injury, it often gives you some diarrhea. You can have both at the same time. All right? Now, the diarrhea from COVID can make this slow motility thing not so bad. You take the glutamine, COVID damage starts going away, the diarrhea from that goes away. Now this slow motility thing starts getting worse, and that has a result of dropping their blood pressure. And we talk about this on a bunch of other videos. That blood pressure drops, the brain reacts in a panic, more hyper, hungry, anxious, aggressive, okay? So if you take glutamine and you see this, to me, that's an indication you have this problem. We got to solve this. This is good news, okay? That means we found something we can fix that's going to help your family member recover faster, okay? That's how you got to look at that. And we've got to go after this, and we've got to solve this. So what we're doing now is, if you get this agitation, we're having the kids they're taking the glutamine twice a day, excuse me, and they're taking Miralax with it to help with the gut motility. And that's working. We've had a few cases now where once they've added the Miralax twice a day to the glutamine, within a few days or a week, that behavior calms down, and they're still on the glutamine. And remember, you only need this for about 8 weeks to get this to all heal up. And so they're continuing on it, and the parents are saying within a month, they're seeing other things start to improve. Blood pressure regulation, just other delay, things like that start to improve in the kids. And that's from the successful reduction of inflammation here in the gut due to the glutamine. All right? So most parents, when you use the glutamine, most adults, when they take the glutamine, they don't notice anything negative, and most are like, wow, a couple weeks, better. That's large majority of everybody. If you do have like, oh, gave Billy constipation, or, whoa, Billy's behavior is a lot worse, those two things are signs that the diarrhea issue from COVID went away, meaning the glutamine's working. It's just kind of causing a nuisance for you now, and you might try that Miralax, adding the Miralax to the glutamine twice a day for several weeks. You don't do it forever, 6-8 weeks. It seems to be roughly by then the parents are like, yeah, we were able to back off on the Miralax, stuff like that. So keep that in mind. Don't give up. If you see these negative responses, it's good news. We found something we can fix that's going to help you or your child. All right? Other than that, everybody have a great day. Take care now. Bye.